So, good afternoon. This is a session on workforce for integrated care, the future workforce. This is a plenary room, but we don't want to have a plenary. It's not only them talking, we would like to talk to you too. So we are going to spend a little bit of time them sharing their experience and some of the concepts around the workforce for integrated care, but then we would like to open the mic. So we're going to invite you to interact with us and give us your opinion, comments, questions, whatever. If I know this is a proposal, you don't have to do it, but we've been sitting the whole day, so whoever wants to walk to the mic and talk, it's invited to do so. If there is somebody who doesn't or cannot walk and wants to do from there they are sitting, just raise your hand and somebody is going to bring you the mic. Good? So, integrated care workforce future planning. We are going to have a lot of sessions during the conference around workforce, and we already heard about a lot of challenging. It's difficult to find workforce. We cannot actually hire them. There is no enough workforce. We don't have enough, or it's decreasing the volunteering. What are the skills for the workforce? We are not going to cover it all in this session. What we are going to talk is about some of the things that this experienced panelists are going to give us some tips, each of them from their own experience, and then we're going to open the discussion. But I do this many times, if you've seen me talking, Eva. Workforce is not a term that translates very well to different languages. I've done to my own language, and then the results I translated back to English. I did the same with the Spanish, and with Catalan, and with others. And when I double translate it, I get that we are talking about health personnel, or that we are talking about workforce, we are talking about workers, or labor force, and one I like a lot, it's manpower. So workforce is a term that is not clear. Who is workforce, and who is workforce when we are talking about integrated care? And I included these two definitions. This is not the final definition, so I want you to think who is missing in this definition, or if you agree. Because a long time ago, WHO said in one report that workforce for healthcare is all people engaged in actions whose primary intent is to enhance health. And then in 2018, when they were trying to describe primary care workforce, they said that, again, all occupations engaged in the continuum of health, this was in the context of primary care, but also all the people engaged in the social determinants of health, including caregivers and volunteers, something that sometimes is called invisible workforce in some context. So this is a reflection, just to start the session, who is the workforce? And this is we're coming from a session from the International Journal of Integrated Care, where we made the decision to talk about co-production, to say who are the people we are co-producing. When we talk about workforce, are we talking only about health practitioners? Who is workforce? So with this small introduction, we are going to have Marlo de Krupe here. They're going to introduce themselves and explain a little bit what the background is. If you want to know a little bit more about them, their bio is in the app. And also, can I encourage you to contact them directly during the conference through the app after the conference if you are interested in anything, because one of the aims of the conference is networking and creating these relationships. Also, for you to know, this session is live at the moment and is going to be recorded, also available after the conference. So with that, Marlo.
Thank you very much for your introduction. Now, I prepared this and I made a question, but I've changed my mind. We're going to get interactive. As you can see, I've been involved in thinking about systems and systems change, and so I want to ask you a question, and I would like you to try and answer it with somebody else. So I want to ask you, what do you think about when you use the word complexity? You have like half a minute to think about it, and then I've spoken to before, and talk to them about complexity and what it is. Because I think for a changing healthcare, we need to change our minds about complexity. Of course, we want simplicity. We don't want problems, we want solutions. But yeah, we need to embrace complexity. So please think about complexity for a little bit. What does it mean to you? I'll give you 20 or 30 seconds, and then I'll ask you to look around the room and find somebody to talk about complexity with. To keep track of the time. I'll be back. I'll just make one round. So I have to start. Okay. So when you talk about complexity, maybe you can spend a little more time on embracing complexity. So what do you need as professionals to embrace complexity. You can stay where you are and talk to the people you were talking to. Rudolf, you're good. Yeah, you do well. Yeah. So what would you need? What do we need in order to be able to embrace complexity, to not shy away from it, to stop analyzing everything until it's simple and no longer resembles real life? So you have 2 more minutes to think about that. And then we all know the answer. Yeah. It's interesting. So maybe we can start to wrap this up. I'm very curious to find out what you need to embrace complexity. Is there anyone that wants to comment on that? You're free to come up here. It's nice here. It's warm and dry, and nobody hates you. So if you want to come up here, that's okay, but there's microphones there too. Or if you just want to yell across the room, that's fine with me. Oh, the audience doesn't hear you, then, the online audience. Anyone wants to comment on what you need to embrace complexity? Yeah.
Dorota from Poland. My language is not so fluent. I'm sorry for that. But for me, complexity is team working. Because when we try to prepare a care plan for a patient, we should work together with other professionals. Complexity isn't for me assessment of the patient status, health status. But for the other side, some of people are thinking that complexity is only assessment of the patient and prepare care plan. For me, it's team working together with physician, dietitian, maybe with midwife and others who can assess the needs of the patient and problems, and then decide from themselves what kind of intervention they can prepare for the patient. For me, this is complexity.
Thank you so much. Is there anyone who wants to add on that, or? Yeah, Clara.
Hi, so I'm from the United States, and for us, unfortunately, complexity often means that there is no access because one does not have the right type of insurance. Okay. And so the system of health and the idea of accessing care when one needs it is often additionally complex because of no available coverage of the needed services, especially for someone with multiple comorbidities that may range from physical to mental health to intellectual to et cetera.
Yeah, well, I like to think that we're much better than the people in the US, but even in Holland, our financial system does not allow for patients to have multiple problems. Yeah, so that, I think across I see people nodding, so yeah, there is a big problem there that we should solve. That's what we're here for. Any other comments? Okay, very happy to have been here, thank you.
So we are going to have Dr. Claudine Cosis now, if you want to come. Can I ask two things? One, when you come to the mic, would you like to present yourself, like name and where you're coming from? And then also, like, I know it's not comfortable for everybody to come here, so we'll have a mic. Just raise your hand and we'll have a mic passing by, okay? So Claudine.
Thank you. Thank you. It's interesting, the question of complexity. The organization that I work at supports people with multiple complex needs. So, you know, when we were talking about that same question up here and with my colleague here, I was saying, for me, complexity is where all things intersect, right? And because our system believes in only looking at what they see, and if you go into the system, whatever system it is, and ask, they'll say, what are you here for today? And they look at that. They forget that you're a woman. They forget that you're trans, you know, they forget that you're also culturally different. They forget that maybe you have a medical condition, and you know, you could have anything that's not seen. However, those things are set aside and they look at the one thing. Then what happens is they deal with that one thing and the other things have a domino effect that wasn't dealt with, and then it gets even more complex. So our system's set up in a way to prevent the unraveling of that onion so that we can get to simplicity, plain language, and all of those things. That was really cool. I really like that. So I'm here today just to give you a little sense of what I'm doing within my workplace, and I did my dissertation on congregate care. So the workers who work for individuals in long-term care, or they could work in a group home, or could work in any other caring or job. So what I've noticed as part of my research was that exposure to indirect trauma is one thing that we also don't look at within the caring sector. We look at it in policing, we look at it in correctional, but we don't really look at it in those occupations where we support people to live a good life, or even our own families at home when we support them. There's no concept of trauma within that caring population. So one of the things that I focused on was psychologically safe workplaces. How do you make the workplace safe enough for your employees to access all those really cool, available, well-funded services? How do we do that? One of the things that we know is that 20% of individuals experience some kind of mental health issue. However, very few of those same individuals will access any kind of support. And why is that? You know, that was one of the things that I looked at is, what is the perception of the assistance or support provided to employees that would help them see that it's safe and that they could access those services? It is one of the things that we still struggle from an HR perspective to measure the uptake of things such as employee assistance programs. Why are they so low, and how can we help our workers access that? So organizations know that when individuals feel comfortable, feel safe, they will decide to access services. And the challenge, though, is how organizations can help their workers feel that they're more valuable than the bottom line. And that's what usually it turns into. Is it the money you're making, or if you're in social services or the caring type of jobs, how can we make sure that it's not about, you know, only the balancing of the books or quality outcomes for your funder that's important, but you yourself is important, so that you feel that, oh, they care about me, so I'm going to access those services. So using organizational support theory, that was the framework that I used to do my research. And underpinning that is the concept of reciprocity. It's you do for me and I do for you. I mean, if you ask any 3-year-old on the street, anyone in basic school, go ask your kids, if you have kids. I asked my son, can you clean out your room? And he'll look at me like, well, it's in your house, what do I get? And I'm still trying to wrap my head around that, right? But the concept of reciprocity is really important in terms of organizational support. The perception of being valued, the perception of your contributions being valued is really important in your workers accepting and going and taking care of their well-being. So one of the things that we need to look at is how do we equip our leaders? And when I talk about leaders, I'm talking about our supervisors, really, the direct supervisors, not the CEO, not, the CFO, unless it's their direct reports, but the people that you interact with on a day-to-day basis who evaluate you, your work, and your behavior. How do we equip them to make people feel comfortable accessing services? So this is a big part of what we're talking about when I talk about perception. If people feel that they're being recognized and valued, they will access services. At the end of the day, we need to remember that organizations are all vying for the same workforce. We're a global workforce. You can hire anyone from anywhere around the world. So if you want to be able to attract them, how are you going to make your workplace a safe place for your workers to stay with you as opposed to go somewhere else? Really important, especially right now where recruiting and retention is such a buzz in every organization. It is at the table, the discussions are happening. So we need to keep in mind that in order to do this, we need to be responsive, we need to be person-centered. That also applies to how you apply your benefits, right? It's not just about services to clients coming in, it's also about the benefits you're offering your employees. So how can you do that? How can you be timely in that? And how can you make sure the concept of reciprocity is part of any strategy? Thank you.
Does anybody in the panel want to react to what Claudine said?
I can just share a few notes that I've taken. Thank you for this presentation. It's not an easy thing to do, but I think we should be working towards creating an organizational culture where well-being and mental health supports are values and are seen as important. And like always, you lead by experience. So perhaps considering distributed leadership where the individual perspectives are valued. And it's not about money for people. A lot of the time, their attention is when they feel valued and when they feel that the job provides the opportunity to develop. And you cannot develop and learn if you're not in the right state to do so. So you need to be supported at different levels. And I don't have the answers, but I think the word complexity will be, very frequent today, but it's a very important topic to consider.
Thank you so much. Victoria? So many of you know already Victoria Stein, but if you would like to present yourself and...
Thanks, Edel, and hello, everyone. Yeah, I'm Victoria Stein. I'm partly working at Leiden University Medical Center at the Master's Program for Population Health Management. I'm also a long-time networker in the International Foundation for Integrated Care and in the Integrated Care Academy. And for those of you who know me, know that I'm very passionate about the topic of workforce and education and training. So I think it's another good time to actually get interactive. And what I would like you to do very briefly is just get up, walk around in the room, and without words, just looking people in their eyes and trying to meet someone. So just without words, walk around, walk maybe to someone you don't know yet, and try to get and meet them. I said without words. Okay, thank you very much. I find it really interesting how we actually get to know people. And whether it is, so this side over there was a lot better with following instructions and not using words. And I saw people nodding to each other, smiling at each other, showing their badges. This is really what workforce and working together in interdisciplinary teams, in transdisciplinary teams is about. It's getting to know people and building trust. And you can only build trust when you're in the same room together, when you actually build up a rapport, a relationship, when you can look each other in the eyes. And that's one of the reasons why we encounter so many problems when we talk either of complex situations. We tend to complicate matters even further by not really, for example, picking up the phone and asking a question, but because we're so used now to working in our own little silos, we think that it's all up to us, and only we have all of the answers, and only we are the ones responsible for either solving the problems of a family or of a patient or of another professional and colleague. So it's really, when we also link it to the question of psychologically safe workplaces, it's about really giving the space to people to come together as teams and understanding what is my role as part of a complex system. Because the truth is in integrated care that we can only do this together. And it's not just the physicians, the hospital, the social services who have all the answers. On the contrary, the answers come because we come together in a transdisciplinary, interdisciplinary way and actually think about how can we together improve service delivery. And so that is a lot about culture change. It's a lot about education and training. It's a lot about rethinking how we distribute leadership, how we manage teams, processes, and budgets. Ultimately, it is about really changing the mindsets of people. What is it that is important to me? What is it that is important to me as a team member? And how do I want to work together with other professionals, but also with the families, the clients, the patients? This question around who's the workforce is really interesting when we think about, if we say it's the professionals, well, are the family caregivers then the unprofessionals? When we know that actually most of the workload is being done by families and communities and the neighborhood. So where are we, if we define ourselves as the health and care workforce, what's actually our role? What is it that we are responsible for? And that really should be to ensure that for the 8,000 minutes a year, those 24/7 families, caregivers, neighborhoods can really take care of their loved ones. So when in these short interactions that we have as a system with these people, we ensure that they have all of the information they need, they have all of the support they need, and they know where to go. So this is really shifting also this mindset around, we're not the workforce. We're not the ones who are providing most of the work. It's the families and the communities. So how do we enable them to do the best? And what's my role, what's our role as professionals to really support these families and communities? And lastly, as an educator and a very passionate teacher, I also want to remind you that this is a lot about peer education. We all are teachers. We all are educators. We're all peers, mentors, and coaches, whether we like it or not, whether we realize it or not. Because when young people come into our organizations, into our teams, into the system, they will copy their peers and their superiors. So the way you treat team members, you treat other people, that will be reflected in generations to come, because obviously I want to fit into a new team and into a new organization. So I will behave the way that I see others behave towards families, towards colleagues, etc. So really be aware of that. Reflective practice is a really important methodology to think about. How do I treat people? How do I engage with each other? How do I engage with team members, with our families and communities? And these are all little steps that everybody and every one of us can do from tomorrow on. That there is obviously a huge system that needs to change as well in the education, in the training, in the organizations, yes. But we're all part of that. We are the system, so it's really also making those steps from our side to say, I can change something. And I don't feel overwhelmed because of all of the restrictions. I'm the one who can actually change something in the system because I'm part of it. Thank you.
Thank you so much, Victoria. One of the things that you mentioned are roles, and I think Anneka Van Boot and Hanneke Peters, they're going to talk about a specific role and experience. We'll have time to reflect together afterwards. Can I just tell you that for whatever reason, the app stopped working for me, probably my own mobile problem. I know you usually can put questions in the app, but it doesn't work for me, so I won't be able to say it. So, get ready for later to come to the mic.
Thank you. Yes, another thing, if we talk about complexity, then we talk about adding new roles in our current healthcare systems or in our ways of working. And today I will talk a little bit more about the nurse practitioners. It's maybe still not a really quite new role, or maybe not a new role, but it's still a quite new role in our workforce. So start with a brief introduction about the nurse practitioners. So it's quite small on the big screen. The nurse practitioners in the Netherlands, we introduced them around 25 years ago in the late 90s. Already we have a small 4,000 nurse practitioners working. They are all educated as bachelor nurses and added a Master of Science program for 2 years. And in that master program and also in their daily practice, so as they are deployed as a nurse practitioner, you really recognize the T-shaped model. The T-shaped model means that they are educated and or trained within an expertise, especially also when they are deployed, an expertise mainly in a patient group, for instance in psychiatry. And then they also have some boundary crossing, so the horizontal S, competences, and these are very important in performing their daily work. So boundary crossing competences as doing research, projects, quality, but also supervision or training, educating, being peers, having projects, or the leaders in integrated collaborations. And nurse practitioners do have a unique role, as they have, as well as they are educated in the nursing domain, but also they are educated in the medical domain. So they are also boundary crossers between the different domains. And since they have a full authorization by law to prescribe medication, for instance, they are from natural the boundary crossers in the healthcare system between the primary and secondary care, for instance. We in the Netherlands see them around all the settings, so in the primary care, mental health care settings, but community care settings and also in hospitals. So that a little bit more elaborate on this, we have the primary healthcare system, community healthcare, the general practitioners, the social care. We have the medicalized specialist care, more the hospital care, the mental health care, and we see more and more the intermediate care concepts. And we see more and more in the last 5, 6, 7 years, nurse practitioners providing roles in the intermediate care concepts. As we have general practitioners in the primary healthcare settings, the medical specialists in the hospital settings, we have nurse practitioners crossing the boundaries and setting up, have initiatives, develop such kind of concepts. And we see that they strengthen the primary care, so we call it also primary care plus. and in order to prevent hospital admissions, but also to shorten the hospital admissions. So really strengthen the primary care. So if you look to what are they doing or their beliefs in their work, then we see that the type of care they do is a combination of medical and nursing care. So they really integrate these types of care, not as separate tasks or roles, but really integrate these two domains. Their vision on care is really holistic, person-centered, and they use their nursing competences in recovery and in functioning of a patient. So really integration of care, care, cure, but also the core. Core is more like the health skills for someone, for a person. Their focus in their care is mainly on proactive, I would say. It's advanced care planning, but also they use the new technologies. They are very innovative in producing or in delivering their care. And I would say, last but not least, especially not least, they have a leading roles in the coordination of care. So they are the leaders, as the title is, the leaders in the care networks we see. So one of quite a simple example is the dermatology at home. It's a hospital on wheels program. There were a few nurse practitioners who worked for years in the hospital, and they concluded, no, we are not delivering the right care at the right place at the moment. The right care to the right place is much more delivering this type of care for the elderly patients or for patients with complex care needs at the patient's homes or in the nursing homes, so don't have to transfer the patients. And now this is now from 2016 on 2018. It was a real, you could say, complex implementation, but nowadays it's going on and it's scaling up, this initiative. It's really hospital care delivered at the home. It's a high satisfaction. Patients feel that this is not only the medical care, but also there's attention for the patient as the whole, in the whole system. And we see also that the costs of care are really decreasing by adding these kind of services compared with care which was previously delivered in the hospital. And if you see to the accessibility of care, this care is very timely because it's not very complex care. You have high waiting lists in the hospitals, and especially for this type of care or the patient group, you want timely care to prevent that it's going wrong. So this is one example, but we have examples in hospital at home care, intermediate care concepts for the geriatric, psychiatry, for lung diseases, for instance, for heart failure, so a lot of different patient groups, and also much more for the multimorbidity, so patients with more care and cure needs. If we see overall what are the results, then we see a lot of positive experiences. And we did research about that, and all experiences are positive, you could say, but this is still very in the early phases of the development. So the start of the innovation, you could say, we see plenty of opportunities. The nurse practitioners, the people they work with, see plenty of opportunities, but there are also a lot of obstacles. And since this development of these nurse practitioners and taking the leading roles in integrated care concepts, and they have all kind of the same or maybe something different obstacles or challenges to going on, we thought it's important that they help each other, they support each other, but also share ideas, and that they think along with each other to bring their own concept a step further. So therefore we introduced a learning community with nurse practitioners leading in that, and in this learning community they help each other, they discuss issues, they discuss the implementation process, and they help each other further. Hanneke, my colleague, she is I don't say the leader, that's not good, but the coordinator of our learning community. Could you maybe a little bit elaborate on this?
Thank you.
It should, but it doesn't. No.
No, it doesn't. Now it does. Thanks, Anneke. That's correct. We created a learning community, just started by meeting each other, telling each other the stories about different projects, experiences, challenges and how everybody coped with them. And after that, we started to advance in the way we meet each other, created really a network. And the nurse practitioners as professionals are the core of the network. And we created also a shell around them of the stakeholders they work a lot with. And with the professionals, we meet regularly every month and discuss the topics they bring up themselves. And afterwards, we meet once in now half a year, I think, with the stakeholders and discuss the outcomes that we discuss with the professionals. And in the shell, there are managers, but also we have other healthcare professionals like medical professionals. And so together we try to make a next step.
Yeah, and I think at the learning community, what is really working is that we have time to reflect to each other. If people go, we finish the session, then they all are very happy, and it really helped them to reflect on each other, to share ideas, to inspire each other. And then I think that is one of the solutions in our workforce in integrated care. Thank you.
So, and last but not least, Dominika Lisieka, you'll see many of the people in the panel, they've been involved in lots of education and training activities, and they've got lots of experience. And Dominika is involved in one of them that we do together with the MTU University and IFIC. You'll see that in the app also, and she's going to share some of the experience in one of the training activities.
Thanks, Idel. Good afternoon, everyone. Am I allowed to make a comment before I start? I just wanted to, I've been thinking about Victoria, what you said about building trust and working with communities, and I think for that to happen, communication needs to be absolutely brilliant, and we need to speak the same language. And I just wanted to very briefly share an example with you of a study we did in MTU last year, where we evaluated the program, self-management program for family carers of people living with cancer. So we took a program from the States and we did a study to see whether it would work in Ireland. And when I was looking and designing the study, I was very much thinking about outcome measures. Are we reducing depression, anxiety, costs for healthcare, etc.? And then I ran a focus group. And what people said in the focus group were family carers of people living with cancer in Ireland. And they said to me, well, we don't like the name of the program. And the name was Building Better Caregivers. For two reasons. We don't perceive ourselves as caregivers. And the second reason is that we're not good enough. So language is powerful, and I think we have to make sure we speak the same language in order to build a community that understands and provides integrated care. And with that in mind, I try to bring that to the education. So as Idel said, I work for MTU, and a few years ago, MTU and IFIC come up together to develop a program. And just briefly context. So in Ireland, as in many countries now, we are observing changes in the population profile. We do have increase in the population. We have more people living with chronic disease and aging population as well. And Dr. Sarah Barr this morning spoke about her involvement in Sloan Care strategy, which is very important and which provided new direction for the health system in Ireland. And with that in mind, over the last few years, there was an increase in creation of integrated care teams and workforce. So maybe not all of the sudden, but for a lot of people, it was the first experience of being in an integrated care team where there was no educational program to help them understand what integrated care concept is about. So with that in mind, the program was developed called Certificate in Principles of Integrated Care. It is 15 credits module at level 9 QQI approved accredited. And the aims of the program are to develop critical understanding of concepts related to integrated care, to teach multiple perspectives. So you look at the same issue from the perspective of the system and policy, from the perspective of the patients, from the perspective of families, communities, etc., and to apply it to practice. And in regards to the structure, content, and delivery of the program, it is a 12-week program delivered online on Thursdays afternoon, and each session is divided into theoretical components. So we typically have 2 speakers, a mixture of international and national, so Irish speakers, experts in different areas of integrated care. Then we have breakout rooms where students talk about a solution-based problem. We don't want to keep highlighting the gaps. We wanted to encourage people to think about what positive change they can make tomorrow. And in terms of, and then at the end we come to a full classroom discussion. So the structure is very defined and it works, but our content keeps changing. It is very much based on the pillars of integrated care, but we have learned that the workforce, the expectations, the experience, and I guess the expectation of the program keeps changed, and I'm going to talk about it in a second. We do collect data, so that's why it helps us to evaluate what we're doing and make changes going forward. We collect data before the course, after every session, and then at the end we do a full program evaluation. And the majority of participants, I think it's in the region of 95 or 97 even %, have been funded through enhanced community care programs to take part in the course, which is absolutely fantastic. So 2 days, what have we been doing? The program started in January 2022. We just finished the 5th cohort of the program last Thursday. We have had 187 learners through the program, frontline managers, nurses, allied health, social work, medics, pharmacists, a mixture of different people involved in the integrated care teams in Ireland. Content is very important, theory is important, but kind of becoming less and less because people coming to the course know more and more. There is definitely a shift. We don't have to talk about what integrated care is. We talk about how can we measure what we're doing, how can we improve that. So over the last 5 cohorts, we definitely see change in the workforce and their understanding and application of integrated care. But what's very important to them is collaboration and interaction. So we try to modify how we organize the program, how we assess it to promote that. There was a request, for example, to have something in person. So we've organized a symposium that now is going to happen again in 2025. It is very much a work in progress, but hopefully we're going in the right direction. And just some quotes from the students who completed the program last week to illustrate their experience. This course has opened my eyes to using different approaches to how we care. Integrated care is innovative, but we need more people talking about it. And even though the process of integrated care is slow, it is the way forward to get away from the medical model so that we can include our service users in the decision-making process. I have better awareness of integrated care, and the third one, it has made me look at my own role and how every person can influence change and the service provision. Not to be disheartened or frustrated with delays, etc., but to push forward with your own area and lead when you can. So with that in mind, this was the question that I'm going to change slightly because I don't want to finish on highlighting the gaps. So we know there are gaps everywhere because we're dealing with complexity every day. But how can we address them? So there will be gaps in education of workforce coming from a university. We develop a program, this is postgraduate program. The students expressed their interest in continuing education, so we are developing new programs. But this is kind of not addressing the issue of people not knowing what integrated care is about. So I'm just looking at ideas, maybe from different countries, what has worked in your situation. Is there anything that you can share that will help us do a better job? I think myself that postgraduate level is great, but we need to start earlier at undergraduate level. So I welcome any comments that anyone may have from the panel or from the audience. Thanks very much.
With that also, can I say, tomorrow at 4:30, we are going to have one of the workshops to talk together, discuss together, how can we improve the education and training for the healthcare professionals. It's going to be a specific of that part of the workforce. Can I say something? Because thank you so much, all the panelists. You'll see with the slides that we planned this session. We used none of them, mainly most of them did not be used, or we changed just during the session. So this is one of the characteristics of this era, is like rapid changes, and we require to have like a quick adaptation and flexibility to our workforce, as happened in this session. I think like you didn't feel the change happening all the time, but it happened all the time. Nothing went as planned, because these ladies that know so much, they decided that to adapt to the context of today and to react to what happened earlier, they wanted to do something different. Did you notice it? Yay, nay? No? It went perfectly fine. But this is something we require for our workforce. So that's one of the characteristics that usually it's very difficult to teach. You have to create an environment that actually facilitates that. But also, I'm just going to wrap up some of the comments you've made. And it's like, we talked about complex systems, working in complex conditions, a complexity of a team working, how actually we have to create safe workforce, or workplace, apologies, equip direct supervisors to support their workers, how important it is to interact, engage, know each other, and build trust. Again, how important it is to have this culture change, education and training, that we need to have this flexibility to create new roles, that we have to create a learning community and an environment, and we have to do a shared language. And my question is for the panel and also for the people, who has to build this enable environment? Is it the system, macro level? Is it the organization, meso level? Is it the individual or team at the micro level? Like, who does this? And we discuss this a lot in our course, but I would like to hear you all to say, because sometimes it's like we throw the ball, we need this. Okay, who is going to provide that?
Well, thank you for this wrap-up and for this question. And obviously, the enabling environment depends on which environment you're in. So if we're talking about creating an enabling environment for an integrated care team, then it means that you need to locally create the space, the time, the management, and the organization. Usually different organizations need to come together to think about how can we actually allow this team to come together and build a shared language as well and make that explicit. What is it we're talking about? What are the roles and responsibilities? How are we going to interact? How are we going to share information? If it's in your day-to-day interactions with families, with clients, with patients, then obviously you as a professional have that responsibility to create an enabling environment, to create a safe space as well, which means you need to have the education and training and also confidence that you feel you can do that. And then on the organizational and on the systems level, you need to provide those spaces. It needs to be part of a job description that you work in a team across sectors, that you have, it's part of your job that you actually have time carved out for meetings, for communication. And unfortunately, it's still only one of the very, very few examples that I know, and that's the NUCA system in Alaska, where across every level of the management, they have dedicated time, they have 40% of their time in their work schedules is to communicate, to go out and talk to the professionals, to the communities, to the different people involved. So that's really one of their core tasks and activities. And I think that's also where the mind shift and the culture change needs to happen. What is it that we value? What is it that's most important for us? And this understanding that, yes, we live in a complex system, but that also means we can break it down into manageable parts when we focus on, okay, what is it that I'm actually looking at the moment? Is it the day-to-day interaction? Is it the teams and professionals, or the organization or the system? And then you can actually also manage complexity, and it's not complicated anymore.
Thank you, Victoria. Any other comments?
Hello, hello, hello. So, absolutely agree. One of the challenges I think we should wrap our heads around as well is when we talk about speaking the same language, we need to also talk about how we are the system, right? We are the system. Doesn't matter if it's organizationally or society-wise, we are the system. And one of the areas we need to focus on is how do we get that accountability piece, that responsibility piece from our employees, from each of us, that says to find a solution, it means you have to opt in. You know, you can't stand on the side and go, the organization is going to make this integrated. The community is going to make this integrated. Government is going to make this integrated. And that is one of the areas that we have to look at, because there are a lot of employees who are standing back and waiting, or might decide that that's not my job anyway, that's somebody else's job, but it's all of our jobs. So we need to really bring that piece in as well to help everyone understand you are part of the system, and in order for this to get to the place we want it to get to, you need to opt in. You need to embrace that and be part of that active system in order for us to get there.
Thank you. Anybody else? I'm happy to go to the audience. We've got kind of like 15 minutes, but you must have experiences, questions, comments to make. So anybody who would like to take a mic and be part of the discussion? You would like to come to the mic? Nap time is the best one to do exercise. You know that. So like, move.
Awesome. Thank you. Thank you so much for these presentations. My name is Christina Eliashevsky. I'm the director of the Cambridge North Dumfries OHT from Canada. I would love to hear your perspectives on how to navigate communicating the values proposition of investing in your workforce, while also navigating the realities of clinical priorities, day-to-day fires, all of the other things that we have on our desks, because we're finding that there's not very much space to talk about workforce, to invest in workforce. So I'd love your thoughts on that. Thank you.
Thank you so much. Any comment?
Great question. So I'm the CEO of a human services organization. There are just under 700 individuals. And I get that from my staff all the time, at all levels, right? Whether it's the executives or frontline. Claudine, where am I going to find time for that? How am I going to do that as well as this and this and this? And it's a valid question. We have this culture of off the side of your desk is what I call it, where we do things, but then we do other things off the side of our desk in the other 24 hours we have for that day. And that is a challenge. So, you know, being solutions focused, I truly believe in that. One of the things that I bring to my team, so there are a couple things. One is to empower the team to not do anything that is not a priority as stated in the strategic plan. Giving everyone at every level, whether you're on the front line, to challenge your leader, your supervisor, to say, is this part of the strategic plan? When they come to you to say, I want you to do this, or I want you to do that. You empower them to lead from where they are, to be part of the solution. So that's one thing that I do in order to help that happen. Because we don't have enough time to do the nice to do things, you know, the pet projects that usually creep into everyday work. So that's the one thing. There are also the fact that there are many multiple priorities, and being ruthless, and I mean ruthless, in deciding what is a true priority and what is going to help your organization achieve such a thing as integrated care. If we all have the same language, we all have the same vision, we all have the same mindset, then what happens is we can move forward in the same way, as opposed to you deciding, well, I think it's this, so you spend time and waste it over here doing something, and I waste it doing something else, and a year later, when you're going to measure, there's nothing to measure but Jell-O, right? So it all falls apart. So that's also another thing that I do in order to ensure that we can, you know, do what you're talking about. The third thing is anything that's worth doing is in our strategic plan, apart from things that come up like firefighting, like something happens, a family issue, there's a crisis. But planned work helps to move the system and help people to feel that they're contributing in a way that doesn't put a, you know, excess expectation on them, so they're burnt out and tired. So those are some of the things that I do.
Thank you.
Yeah, maybe not a comment, but added to what you said, I think it's very important that we have also, that we realize that when talking about what we are doing and just reflecting about are we doing the right things and doing the things right, that it saves time. And the belief that it works like that, I think that will, we have to incorporate that more in the culture, in the teams or in the professional teams.
I would also add to your points that when you focus on what it is that I can do, what's in my remit, what's in my scope, and actually I focus on those activities and admit and realize there's other professionals, there's other team members who are so much better in doing something else because they've got the training, then I think also this really, the sharing of accountability, the sharing of taking care of people, that will also help in actually cutting down on so many things, just because I think I'm the only one who can do it. So these are, apart from obviously really talking about shared care plans and then more longer term changing organizations and cultures, I think in the short term, in the day-to-day, there's a lot of time-consuming activities that we're not even supposed to do, but we're taking them on because we think we're the only ones who can do it or the only ones who think about it. So really creating this team understanding and creating integrated care teams would also help in actually cutting down on those inefficiencies and cutting down on some of the stress. But then at the same time, I think just really acknowledging, yes, it is high pressure. There is a lot of stress going on, so what is it that we can do for ourselves? How teaching mindfulness, just 5 minutes of mindfulness exercises every day, would also support a lot of the workforce to feel more empowered and feel more in charge.
We actually have evidence to support
Marlo, you have to use the mic, otherwise they don't hear us.
We actually brought evidence to this conference to support your last statement, Victoria. Roderick has a poster supporting that. I would like to know, where does your question come from? What do you do already? What are you looking for now, and have you gotten any answers?
Well, happy to share. So in my role, I'll just take this out again. In my role as the director of the OHT, I facilitate the coordination of our various member organizations, and I feel so passionate about putting workforce planning and provider well-being at the center of what we do. And it's a tough sell. It's a really tough sell, right?
Why is that, you think?
Because we're so patient-focused, as we should be. And so when we have such scarce resources and scarce time to collaborate, the focus of our planning is around the patient. So when we come together, you know, what mental health and addictions clinic will we build to support our communities? Or what neighborhood care team are we designing for our community? But our care teams are people. And so how do we build that space? How do we build that values proposition that we need to invest in those people, invest in that workforce, and create a space where they're centered equally, really, in how we think about system design?
Well, thank you.
Thank you so much.
And is there anyone else who wants to give a tips or?
Take all the tips.
There.
Actually, it would be good when you when you're in a conference, and for some of you it's not the first time, you know that there are many different contexts and experiences. So from your learning, what would be, from your experience, what would be the one thing that you would say to others, please try this, please do not try this?
Thank you. I'll try and answer part of that question. I just want to say thank you very much for the inspiration. I'm Jason Lai, Vice President for March of Dimes Canada, just a stone's throw away from one of our speakers here, which we just found out today. You know, there was a transformation that took place in Ontario, and evidently it's right across Canada, with regards to our healthcare system, and it was very much client-focused. It's very much client-focused. We made a decision about 2 or 3 years ago, though, is that if you're really going to make that effort to be transformational, it can't be entirely client-focused. A good organization has to invest in its people, because if you don't have good people, the client care falls by the wayside. And one of the things that we're trying to do as an organization now is to become one of Canada's top 100 employers, which has nothing to do with client focus in a roundabout way. It really is trying to instill a level of competence and belief in the staff. As somebody who's worked in the field for 30 years for the same organization, I started off as a personal support worker. I think I have one of those rare experiences where I can actually talk the talk and walk the walk, but I can share with everybody today, the further you go up that stream, the more your head's up your ass. The fact is that you start to fall by the wayside in that regard, and it's important to go back to the Gemba, to go back to the frontline experience. And so I really just wanted to thank everyone today, because it is a priority that people tend to put by the wayside simply because there is this client focus. But we have to make an investment in our employees. We have to give them confidence and belief. They have to be part of the journey along the way, and we have to empower them so they have that knowledge. So thank you very much today for the inspiration.
Thank you so much for the comments. Actually, and with Dominica, she knows this. In our course, we've been talking about this, how to improve, what does it mean to improve user experience and so on. And we have had already a few examples in which there's been some change in the service, considering only the user experience and making really poor working environment, that then it's not sustainable at all, because either you cannot have one of the two, not only user experience or only workforce experience. They have to go together. So any comment, reaction to what they've said?
I 100% agree with your comments that we need to, people-centered services and person-centered services are as much about the families and caregivers and the patients as the workforce. And I think that's something that we very often forget, and I absolutely agree with that. So it's really also co-designing a service means not only co-designing it with the people you're organizing the services for, but also those who need to provide them. And very often in implementation projects, especially when it's about introducing new technologies, the workforce and those people who actually need to implement and use the technology are not involved at all. And then they're told, well, this is the new system, you work with it now. And no wonder that they then say, well, but I've already got 100 tasks on top of that. How should I use a new software that's not purpose-built for what I need? So I think that's really something that we need to take on board as well, that person-centered services is everyone involved in the system really, and that includes the workforce, importantly.
Thank you so much. Please.
Thank you, everyone. I'm Kathy Peters, also from Ontario Health Teams, Burlington, Ontario Health Team in Canada. And I just want to circle back to my colleague's comment about, finding the space to really focus on provider wellness when you're really focused on population health management, priority population work. They don't have to be mutually exclusive if you plan it right. So one example we used in Burlington was focusing on seniors, older adults who were at risk, living in affordable housing, less than $22,000 annual income, and many social determinants of health. So we went off to build a combination of housing, health, and social service in a hub model. The focus was on the user, but the benefits of integrating all the service providers, there were 15 different providers going into the building. We streamlined it. 6 years later, when we do provider surveys, we're finding that the providers are having an improved experience. They're doing monthly team rounds. They are building off of each other's strengths. They're not having to do it all by themselves. And so through focusing on the seniors, we've actually improved the model of how they deliver their services to the seniors, thereby improving their experience and wellness. So they're not mutually exclusive. I know you know all this, but sometimes if you go into the situations telling the organizations we're going to focus on providers, I could see why they would want to divert to the user, but you can do both at the same time.
Thank you so much. We need to start finishing. I just want to put a question here because but we're not going to continue here. We're going to have a lot of sessions during the conference, but we didn't talk about, again, part of the workforce who are the carers and the volunteer sector that much. We know that some of you included it, but we also need to make sure that we create an environment that we support them, but also that we create a way to help them to provide quality, because the users need to get quality of care. It doesn't matter who is the provider. So we've got 2 minutes. Can we have a quick round of final words? Marlo, you want to start with the mic, please? Mic.
Good. Final words. Read the book that is called Moral Ambition.
Beat that.
Don't forget that employees are people too, and that whatever you are planning must also include them.
And don't forget that your peers, mentors, and teachers as well, whether you have this official role or not, always think about how do you engage with other professionals, with colleagues, with your superiors, with your junior team members, but also, obviously, with your patients and family caregivers.
And in addition to that, let's keep learning together. Give room to keep learning together.
Yes, and adding on that, take time not only for learning, but I think also for reflection with students, with the users, with our professionals, because I'm sure that time will also save our workforce.
And invest the time to get to know people you work with. That includes patients, families, and other professionals. Just spend time to get to know the people you work with.
Thank you so much, all. Any final comments from the audience? We've got some time. No, you're happy with that? Okay, so let's finish then. Please feel free to interact during the conference and after. We are building a community here, so we need to create this movement all together. So thank you so much for the session and to the panelists.